Hello everyone, this is your host Rohan Tandel from InnoHealth Magazine Studio. I welcome you to this podcast produced by Innovation Curious with a mission to spread awareness and knowledge of various facets of healthcare innovation. This podcast is the first episode from the Industry Blitz series from InnoHealth Magazine, the first magazine in India on healthcare innovations. In this series, we would be exploring the aspects of industry from perspective of industry experts. Today, we are going to have a conversation with our guest speaker, Dr. Swati Subodh. Dr. Swati is a scientist and public health professional in the field of infectious disease for nearly 20 years. Her work spans from basic research to supporting promising public health innovations. She has published widely and has led research teams in various industry-sponsored and government-funded projects granted to her. Dr. Swati has written for various prominent media platforms, has delivered talks at TEDx and the UN headquarters, to name a few. She is a co-founder of 1M1B Foundation and is consulting at a premier bio-innovation hub in India. She has worked with the Council for Scientific and Industrial Research and the Indian Health Fund, a Tata Trust-seeded organization, in her previous roles. As an entrepreneur, guest faculty, and member in national institutes, she evangelizes #bridging silos to accelerate ideas to action. The topic for today's conversation would be, is entrepreneurial ecosystem an ally in the COVID battle? Welcome, Dr. Swati, to our podcast. How are you today, ma'am?
Hello, Rohan. Thanks for having me. Doing great. I hope you and the viewers are doing great as well in these challenging times.
To start off, I would like to elaborate on the flow of the podcast. I'll be asking you a few questions and we'll be discussing your viewpoints on those questions. To start, I would like you to give us a brief on what an entrepreneurial ecosystem is and what are the major components of this ecosystem.
Yeah, thanks, Rohan, for that question. So to start with, I'm sure we all have heard about this terminology called the entrepreneurial ecosystem. So let's start with understanding what exactly it is and what are the nuts and bolts that go into an effective and seamlessly working entrepreneurial ecosystem. So at the center of the entrepreneurial ecosystem, quite clearly, is a promising idea, a seed idea or an avant-garde idea that challenges the status quo of a problem that humanity is facing, or a challenge that can accelerate or non-linearly lead to a solution, so that outcomes can be faster and better. This is also something that brings the ecosystem is basically that brings the idea together to life sustainably and creates value for value and wealth for its stakeholders. So it is a blend of social, economic, cultural, and political components, and I'd like to highlight that a little bit. So the entrepreneurial ecosystem, if you visualize, has 6 major components. One is the entrepreneur himself or herself who has a bright idea. So we typically call it, the human capital, the person who has the idea, the requisite skills to take it forward. Second would be a support system, be it in terms of infrastructure, be it in terms of support from legal, accounting perspective, so forth. And third would be a culture. Now, culture is something that is very important because traditionally we are told to be risk averse, to play it safe, but entrepreneurship is anything but playing safe, and it requires a certain risk-taking appetite and the willingness to fail and get over it, dust yourself, and learn from it, pivot, and do it better the next time. So that is definitely a social and social culture that we inherently have. So the entrepreneurship ecosystem definitely comprises of a more enabling culture. Fourth would be finance, in terms of the microloans, angel investments, venture bodies, private equity funds, and so forth, who can put their trust in that idea and willing to support even at an early stage when they've not the entrepreneur has not been able to validate it large scale. Fifth will be the policies. and that is where the government policies come in terms of accelerating that idea through the pilot stage and then to the market. And advocacy is another aspect aside from policies and regulatory norms, which kind of gets bucketed in this fifth component. The last component, the sixth component, is the market for which this is kind of intended for, and it requires both early stage customers who can put their faith in a new idea, as well as networks and the diaspora and multinational corporations which support these ideas. For example, the healthcare market, for which many of the innovations are targeted and maybe specifically of interest to the audience listening in today. In terms of the government, I would just kind of like to elaborate that a little bit, that one specific enablement in the Indian ecosystems per se has been the Startup India seed fund scheme, or you would have heard about the Startup Stand-Up initiative, where a corpus of nearly 945 crores had been put aside. So this is the kind of trust that the government kind of puts in for its entrepreneurs. And so to summarize, when we talk about startup ecosystem, we have the entrepreneurs, we have the mentors, we have the government, we have the universities and agencies where these ideas are supported, accelerated, and incubated, investors who help the entrepreneur take the idea from a very early stage to a mature stage, and then the service providers or the technology transfers, which enables a sustainable kind of inflow of this idea into the market. So that's a kind of a longish answer to your question, and I hope I've been able to explain what exactly the startup ecosystem is.
Yeah, ma'am, that was elaborate, but it explains it all. Coming to my next question, how is the existence of such an ecosystem important for the economy?
Well, I would say that, increasingly over the past couple of years, the essence of the ecosystem and what it can deliver, not just for communities, but for countries at large, has really come across in a big way. And, this point I'd like to highlight by giving two aspects where the startup ecosystem is specifically being looked at very favorably from a pan-country perspective. One is, this allows starting small to solve a bigger problem. So essentially, when you bootstrapped entrepreneur kind of puts in all the rigor for one idea that he or she might be very passionate about in solving, and a solution that they think that can solve that particular issue. So they have a more kind of system thinking, design thinking approach, and without much nudge, they are already driven to solve that problem. And so there you have one person who's committing themselves to solving a bigger problem. I think that is at the crux, and we don't have, as a global community, I don't think we have any dearth of problems to solve, and it's just increasing with the different conditions brought on by the climate change, by healthcare, by so many. I mean, you name it, and there is something to be solved and made better. The other is, we are a country of, we are a very young population where a lot of our citizens are below 30 years of age, and this is technically a population which is very technology savvy, and technology is a very important aspect to solving problems old and emerging. And I'll give you an example here. Cutting edge technology for old age, century old healthcare problems like tuberculosis and malaria, for example. Artificial intelligence is being used for identification of TB bacteria in a culture, in a lab culture, and then you shift shift to the aspect which we are all dealing with today, which is climate change, or the SARS-CoV-2 virus, which has caused the global pandemic. So the same technology is being used. So that agility to employ those technologies for solving bigger problems, I think in a more sustainable, which is a very imperative, it's a very crucial word and operative word, and also cost effective. So sustainability and cost effectiveness, which not just works at an individual level but at a higher level as well. The other thing is, just to kind of tell you how much the country stands to benefit, if any, or a substantial fraction of the ideas coming out of the entrepreneurial ecosystem come to the market, is consider climate change. And many of the dialogues that we hear today are a lot of healthcare related issues are also emerging due to the climatic changes. And about 150 million Indians live in a climate hotspot, and there could be a cost of as much as 1.2 trillion dollars of the country's economy, which is siphoned off by 2050 in solving these problems. And if you have an entrepreneur who's delving in this, there's a huge amount of saving that the country does if the entrepreneur succeeds. So there is a high risk, high reward kind of a situation where an entrepreneur is trying to solve a problem which has a much broader and a bigger potential impact. And so this is where enabling entrepreneurship, entrepreneurial ecosystems become very important for the country's economy, and also being a healthier population going forward. The second thing aspect that I would like to draw your attention on is, from an economic point of view, the country also benefits if we are more a nation of job creators rather than of job seekers. As I told you, we are a young population, and the trajectory or the rate at which the jobs are increasing is much lower than the number of people who are going to potentially be in the workspace 5 years down the line or 10 years down the line. It just doesn't match up. So entrepreneurship and entrepreneurial ecosystem also enables that you are creating opportunities for this workforce of the future, which has the requisite skill sets to be jobs ready and to kind of fit into this when they finally enter the workplace. So till today, as of December 2020, government has recognized about 41,000 startups, and they have been able to reportedly generate about 470,000 jobs. And this is only going to increase now on, and therefore the investments also that we are seeing are of the order of 10 to 15 billion in just the startup ecosystem by early 2020. So you can kind of do the math that how the investment and what this ecosystem promises has to offer for the future of the country and for the world at large.
Coming to the next session, the pandemic has brought out umpteen challenges in the healthcare sector. What were a few that caught the attention of the innovators? Anything else that remains potentially unaddressed?
Yeah, thanks for that question, Rohan. I think that's a very important question because the pandemic has taken all of us, the entire planet, by surprise. And there have been so many challenges and that many people have been grappling with. But if you kind of narrow that down to a healthcare challenge, which, I mean, the pandemic is largely a healthcare challenge, but within that, I thought, first is a challenge like even a simple thing like healthcare messaging is something that is very important, because you don't want misinformation, you don't want people to not be informed. So there were a lot of innovations that we saw that came up in just kind of beautifully transferring the correct validated information from credible agencies to the last mile. And we saw a lot of challenges there because it was a mix of myths, mix of false news, hype, so forth. And that was one place that the entrepreneurial ecosystem also rose up to in terms of conveying the messaging. So first is healthcare messaging. Secondly, our mobility was restricted. And, the first wave and then the second wave where people actually wanted to seek healthcare interventions and they could not because of the fear of infection. So that was another big healthcare challenge where healthcare systems were in place initially, and people were there who wanted that healthcare, but there was a huge gap because of accessibility issue. This problem was even many folds in rural areas where you have a very poor doctor to patient ratio as it is. And because of the pandemic, even those people, who had some fraction of accessibility to a healthcare center were devoid of that. So that was another challenge, and how that was kind of addressed by the entrepreneurship or the entrepreneurial community was the mushrooming, if I may say, of telehealth solutions, both at the private practitioner level to an aggregator level, where many of the medical fraternity got it onto a single platform so they could see patients, plus a lot of hospitals which are not traditionally known to be in favor of telehealth solutions were also kind of onboarding doctors and solutions to be able to reach to the patients. That was one. The other was, again, adding to the mobility issue that was a challenge, were the e-pharmacies that came up. And again, here you saw a lot of early stage enterprises, suddenly entering the market, and suddenly you see so many new names. One MG is one that you would have heard about. Pharmacy is another one. Similarly, many e-pharmacies came up, which tied up with hospitals or offered services standalone to be able to reach, and through logistic partners, which again was another, fraction of, the entrepreneurship. Many enterprises who were just working on, logistics and supply chain suddenly partnered to deliver the goods to people where they were, because they were not able to move and come and seek those facilities. The other was because this is a pandemic which is high on infections and transmission rates. So another thing was the diagnostics. Now, how do you screen so many people? How do you do the diagnosis of so many people when the mobility is an issue? So many of the AI-based solutions, self-monitoring systems, self-tracking fitness solutions also came, which enabled people to take charge of their health where they were and monitor themselves at home, and also kind of report any aberrations in their readings in their vital parameters to a doctor through telehealth solutions. So it kind of became a good kind of network that was provided to the patients, definitely to those patients who could afford it, and who could also be who were digitally empowered to use those solutions. But also at the public health aspect, many of the technologies and enterprises have also entered into public health space, where the patients are not really that technology savvy. So they're looking at it from a more community level healthcare system. Was also something that we saw coming, although there's a lot of distance, lot of miles to cover there. But yeah, that was one technology or one challenge that was overcome. The other was the flip side, and now what we are talking about, the silent pandemic, other than the obvious one, is the problem of mental health and well-being. That is a challenge that has come up, so many times, and it's just a problem of what to focus, and in a case where everything seems to be such an overbearing challenge. So mental health and wellness was again another challenge that came as part of the pandemic. And again, many early stage enterprises have got into that space of not just connecting to a certified psychologist or a psychiatrist, but also monitoring in terms of what is the level of well-being, mental well-being, and so forth, and connecting them to resources so that they are kind of adequately taken care of, being sitting at home in isolation, yet kind of reaching out to them so that they are mentally empowered and well. The one thing I think that we can definitely do more of is something that you would have encountered. We heard a lot about the variants of interest and the variants of concerns, which came up as suddenly we became intelligent DNA wise. So genomics came up in a big way during the pandemic, and we have a lot of solutions coming up. But I think that is one area that has just emerged, and something that we should definitely look forward to having in public health space more going forward.
Okay, coming to the next question. In your opinion, what were some of the healthcare innovations that stood out and created an impact? Can you give some examples?
Yeah, so as I said, there were so many challenges to be solved that I think the startup community grabbed it with both hands, because not just was this a sudden requirement, there was suddenly a receptive market. There was suddenly easing of many regulatory norms, which become a hurdle for early stage enterprises. But so it was, in a way, a perfect storm in that sense, where many of the innovations that were bubbling under suddenly had a chance to kind of surface and try to test out their solution and even scale it in the domestic market. So one is an early stage company, not sure whether many of your listeners would have heard, is Black Frog, which is into vaccine supply chain and doing a good job. They've just started scaling up, so that is one. Fitness trackers at home, I think all of us are aware about, aware that the Cure Fits and the Healthify Me, the GoQs, etc. The other were also DNA-based diagnostics, for example, from Mall Biodiagnostics, which was approved by ICMR. They were already approved for tuberculosis, but then they got a fast track approval for COVID as well. And we see many of these similar startups who suddenly, repurposed their solution to address COVID. And that is something that has been very commendable, because that shows how agile the startup ecosystem can be. And suddenly they, turn around, modify their technology, and kind of address current and present danger very quickly. The other aspect that I would not talk about in terms of just the startups, but a domain, for example, I mentioned that before, is artificial intelligence in the healthcare market, and it has grown and it is growing at a CAGR of 50.2% during between 2018 to what is expected for it to grow till 2025. And healthcare has been a significant aspect of where AI is now currently being used. So you have the likes of Cure AI, who are digitizing diagnostic and screening of chest X-rays, or it could be Docternal, who are using AI for identifying just by means of a patient's cough, they are able to kind of identify whether this is a cough of tuberculosis or COVID or COPD and so forth. So from a distance, doing that screening, not going near the patient is not coming near the healthcare facility. These aspects can definitely be of a lot of use and can be scaled quite a lot. Cold chain, I already told you. Then there were quite a few other in the diagnostic space. Another thing that came up were oral vaccines. Now, vaccines in itself kind of propelled, so fast that within 12 months of the start of the pandemic, we had many candidates in the market. Whereas for many other diseases, you're spending 10 to 15 years to see the vaccine, and many of them might not even enter the market. So that is another innovation that was clearly something remarkable during the pandemic, but more so now to reach scale. So instead of injectables, going to the oral preparation of vaccines, which are easy to transport and easy to distribute to the patients or to the community at large. So that is another innovation that is in the offering. So as I said, there's so many examples that I possibly cannot cover most of the innovations which are very promising, but just kind of top of my head, just mentioned a few.
Yeah, ma'am, those were some great innovations, and I'm quite sure that it helped our country a lot. Coming to the next question, how have the innovations accelerated to the last mile during the pandemic? How can this be sustained and scaled beyond the pandemic?
Yeah, so the good side of the unfortunate pandemic was that we all started collectively thinking differently. And because of a clear and present danger, there was a fast turnaround time where we take years to kind of process. And as I said, regulatory approvals was one of them. In terms of, one was the vaccine, where within 12 months we saw many candidates, not just one, but many candidates entering the market. So regulatory approval, policy approvals, I think that played a key role in letting a lot of the promising innovations come from the lab to the last mile, as we call it. So fast tracking approvals and policies, I would definitely say, was at the top, because there's no point of having promising innovations or solutions which cannot be scaled. And in this case, the requisite policies and regulatory frameworks that was put in place as an emergency response definitely help more diagnosis, more screening methodologies, more patient monitoring technologies come to the market. Many candidates were being tested for vaccine as well as for therapeutics. ICMR also, which is the apex body, medical body for India, fast-tracked innovations in the space of screening and diagnosis. A lot of entrepreneurs were able to kind of put their efforts and have their technologies validated. So that is definitely one. Second is people, philanthropies, and many of the corporates got together to address this common problem, and one of them being one of the many, I would say, was for example the ACT grants, which was Action COVID-19 Team, which was basically is a fund of founders, and a 100 crore grant created by the Indian startup community to give wings to ideas that could combat COVID-19 with immediate impact. And these are the kind of initiatives which just kind of clubbed together, did their thing, and have created so much impact. Another thing are the bio innovation hubs like C-Camp in Bengaluru, which has done commendable work in getting the startup community share their innovations for COVID-19, and now they are in the deployment stage. So that is something that suddenly the structures and systems kind of started aligning. At 1M1, we started working with the community, with the healthcare telehealth infrastructure that we had created, to use the same infrastructure to now be able to deliver solutions for COVID, for awareness programs, for telehealth consultations. So we were able to do that as well. So that is possible when you have an open mind, you have a structure in place which you can kind of suddenly accelerate, suddenly turn around to be able to do that. And that is something that if we sustain it, these structures can have the potential to scale even further than what they have during the pandemic.
Coming to the next question, what more can we expect in the healthcare sector from the entrepreneurial ecosystem in the new normal?
It is definitely a new normal, and we are not at the we're still not at the end of the pandemic, and so much has changed since early 2020. And so it's difficult to say what exactly will be when we finally see the end of the pandemic, and hopefully soon. But one thing that is definitely there, that our healthcare spending as a country has to definitely increase. It was not initially a priority area, a focus area, because we see healthcare in the very traditional terms, and this pandemic has suddenly shifted our mind space altogether. So healthcare investment is something that I think has to be kind of kept in focus, not just at a policy level or a regulatory level, but also at the entrepreneurship level. There's a lot of scope, a lot of things that can be done going from here onwards. Now, to impress upon what I'm talking, I like to cite a study. There's something called the Global Virome Project, which is developed by the scientists at EcoHealth Alliance. And they kind of monitor, viral threats, for example, and, combining factors like deforestation, land use, level of wildlife diversity, then population density, human wildlife, interaction, etc. And, considering all these climatic factors with population data, with wildlife data, and healthcare data, they have been able to map and say that there are many places in the world which are at very high risk of future pandemics. And unfortunately, India is one of the hotspots there. So when we're talking about healthcare, we have to look at it not just from the present moment and, dusted, having sorted out, gotten rid of the immediate problem, but also look at it from a more futuristic aspect and what we need to prepare ourselves so that a pandemic like this does not occur. And emergency, innovations or entrepreneurship initiative in emergency response and pandemic preparedness definitely need to be put in place in the new normal, considering that we are not alone. We share this planet with a lot of other, wildlife, plants, ecologies equally important, and we've seen how climate change can also affect global health, and that is that is the interface that in the new normal we need to be also focusing on, not just healthcare for humans, but from a larger angle, and what experts globally have been calling the One Health approach, where you are considering many other aspects of good health and addressing them. So that is something that the entrepreneurship community could most definitely leverage and focus on, and that is whatever the future brings, but that is definitely going to be part of the new normal that we are heading for.
Yeah, ma'am, I would agree on that entrepreneurs would be the key to the solution in our future endeavors. Lastly, I would like to ask, how can our audience connect with you?
So yeah, that I think that's a very important question, and I love connecting with people, sharing. As you mentioned in my introduction, bridging silos is something that I evangelize. So I'm very open to connecting with people, seeing what can be done together. So Rohan, I'm sure you can share the LinkedIn and Twitter handles with your audiences, and that is one of the best ways. I'm very active on LinkedIn. I'm very active on Twitter, so that is definitely one way of connecting with me, and I'd be happy to be of any help, or we can just kind of brainstorm together.
Sure, ma'am. The link to connect with our guest, Dr. Swati, will be down in the description. To conclude, thank you, Dr. Swati, for joining us for the podcast. I would also
My
like to
pleasure.
call out to our audience to leave a comment with a review and let us know whether you like the podcast. Drop down a comment if you have any podcast ideas or recommendations. You can also connect with us if you have a healthcare innovation journey of your own to be a part of our podcast series. And for more such content on healthcare and innovation, visit innohealthmagazine.com. Stay safe. Goodbye from your host, Rohan Tandel, from the InnoHealth Magazine studio. Thank you.